right, good morning, everybody. Can y'all hear me in the back? Okay. If you can't hear me, just start, raise your hand a little bit so that way I know that everyone can hear what's going on. So today we're going to talk about what tests you need, what your tests mean, why maybe sometimes doctors are a little bit less concerned if your tests are outside the range of normal. And we'll try to cover a wide variety of topics and try to get some general understanding before we get started. So some important points that I wanted to make before we get started with talking about what your tests mean. The first, I think, is this is the most important point. You're not a number. You're not your lab work. You're not your x-ray. You're not your colonoscopy. You are an individual. And so every time that we get a test, we have to think about you as the individual and what that test means in the context of you as a person. We don't just look at the numbers. We look at the history that we took when we talked with you when you were in our clinic. We look at the medical problems that you may have, the medications that you're on. We take all of that in context with these lab tests and numbers. Okay? Your doctor knows you best. So if something I've set up here is not in line with what your physician has told you, you can come up and ask me after the talk or ask me in front of everybody if you're comfortable with that. But I don't want you thinking that your doctor's not doing the right thing if I tell you something different, because they know you as a person, they know your medical problems, and they know your physical exam and who you are in context of all of that. And finally, there's no absolute perfect. Everything exists in a spectrum, especially when we're talking about lab work and vital signs and tests. There's not one absolute number that you need to be. You don't need to be exactly in the middle of the range to be in a healthy range. Our bodies change every day. They change every minute. Your lab work could say one thing if we got it in the morning and another thing if we got it in the afternoon. So that's why we look at numbers in context of a range. Okay? And also, machines and people make mistakes. There's no perfect test. Sometimes we might swap the samples. That doesn't happen very often, thank goodness. Sometimes the machine gets messed up. Sometimes the blood clots. So if that ever happens with you, just remember that nothing is 100% and nothing is perfect. I think another really important question that I'm going to try to answer today is, why don't we test you for quote-unquote everything? I have lots of patients that want to be tested for every kind of cancer, and we just don't do that. The reason why is it's often expensive. And when I say expensive, I don't mean dollars and cents. I mean it takes your time. It can cause you worry. It can cause you stress and anxiety. It can create us to have to do more additional testing that might make you a little bit more concerned or worried when we don't need to be doing them. Oftentimes, an example of this is if we get a scan of somebody's belly and we look at their lungs, sometimes we can find a small spot on their lungs. That spot could have been there for a very long time, and it probably doesn't mean anything. But now that we've seen it on the scan, we're going to ask you to come back in 6 months and repeat that scan. And then maybe in another 6 months and repeat that scan. And every time you come in, you might get worried about, is that spot getting bigger or not? So that's what I mean when I say expensive. Also, it's unnecessary. Oftentimes, if you're not having symptoms of a disease, and the disease is so rare that it's really unnecessary for us to test you for that. We generally like to guide our tests based on your symptoms and your risk factors. And we'll talk a little bit more about that. They can also be unhelpful and confusing and harmful, kind of like what I talked about with the CT scan. Another example would be is if you came into my office for a physical exam and I tested you for the flu and that test came back positive, I wouldn't know what to do with that test if you weren't having flu symptoms. Does that mean that you just got over the flu? Does that mean you're about to get the flu? Or does that mean that the test was wrong? Again, with every test that we take, we have to think about something called the pre-test probability. And what that means is we take your symptoms and your history in context with the test and to see how likely that test is to be true based on that. This is a concept they teach us over and over again in medical school. It's a bit complex and we won't get too much into it, but essentially we need to think about what is the likelihood that this test is going to be helpful in helping me make a diagnosis. Okay, so our outline for today, I'm going to go over, first of all, normal vital signs. That's the first test most people get when they walk to the doctor's office. We're going to talk about what kind of routine lab tests, and I put routine in quotes because not everybody needs these lab tests. These are general lab tests that are more common. We'll talk about health screening for men, women, and what every person needs to be getting based on their age. We'll talk about immunizations if we have time, what immunizations you should be talking to your doctor about getting. And if we have some time, we may or may not have time today, but if we do, we'll talk about general tips about living well and having a better, healthy lifestyle. So your vital signs. The first thing that you get when you go to the doctor is they'll test your blood pressure. These are the normal ranges up here, systolic of 100 to 140. And then the diastolic is the bottom number. So the systolic is the top number, the diastolic is the bottom number. The systolic is how much pressure your heart is making when it squeezes, and the diastolic is how much pressure it has when it's relaxing. Okay? We check your heart rate or your pulse. We check how much oxygenation you're making sometimes, if you ever get that little probe that they put on your finger. And then sometimes we'll check your temperature. So blood pressure. We test people for blood pressure or hypertension. Generally, that's a systolic or the top number greater than 135, or a diastolic, the bottom number greater than 85. If you're over 65, we tend to relax this guideline a lot. The reason why is we've done lots of studies, and when we try to meet those top markers, we make people feel terrible, we make them fall, and we can actually make them sicker by giving them too much medication. So that's why we relax that a little bit. Okay? If you have had a stroke or a heart attack or diabetes, though, we might be a little bit more aggressive at getting that blood pressure down. Again, this is talking about you not being a number. We have to take you in context of your other medical diagnoses. So we can't just look at your age or just look at if you've had a diabetes or stroke. We have to take all of this into consideration when we're deciding if we're going to treat you for high blood pressure or not. Symptoms of having high blood pressure. If you're having a headache, chest pain, sometimes swelling in your legs or feet, blurry vision, these are all symptoms that your blood pressure may be elevated. Again, they might be symptoms of something else, but if you check your blood pressure and you're having these symptoms and the top number is greater than 180, that's an emergency, and you should call your doctor or go to the emergency room. Okay? Now, if it's a little bit higher than the target numbers that we talked about above, you still should probably talk with your doctor, but you don't necessarily need to call 911 or go to the emergency room. Okay, hypotension. This is the opposite problem. This is your blood pressure is too low and you're not getting enough blood flow to important organs in your body. That's usually a blood pressure less than 100. It might be due to infection, you might be dehydrated, or you might be taking too high a dose of medication. Some people can feel the low blood pressure earlier than when they reach that number of 100. Symptoms of having low blood pressure would be dizziness, lightheadedness, you might be confused, or you might be weak. Again, if you're having these symptoms and your blood pressure is low, you need to talk to your doctor, because it could be that we need to stop medications on you, or that you might be having an infection that we need to treat. We really need to look at you as a person and figure out what's going on. Your pulse. A normal range is 60 to 100. Lower pulse, you might have weakness, dizziness, lightheadedness, or fatigue. It's the same kind of symptoms if you're having low blood pressure. Both are functions of your heart, and so that's why you have similar symptoms with a low pulse and a low blood pressure. If you have a higher pulse, you might feel anxious, jittery, a fluttering feeling in your chest, palpitations, all of the above, or you might not feel any of the above. Another word about pulse. Some people have a pulse lower than 60. I had a patient yesterday that came into my office and his pulse was about 50. I didn't worry about it because he was an athlete, he ran a lot, and so some people, it is normal to have a lower pulse. But you should, again, always talk with your physician about any abnormal vitals. Okay? Oxygenation. This is how much oxygen your lungs are able to push out through your body. Normal is around 89 to 100%. This is the percent of saturation of oxygen in your blood. If you have low oxygen, you'd probably feel short of breath, tired, again, dizzy and lightheaded. The biggest symptom of this is shortness of breath. If it's high, you can't be too high. You can't go over 100. There's no symptoms, you feel great. All right? Temperature, so I have a lot of patients come into my office and they say, oh doc, I have a fever, it was 99.6. You might have felt feverish, but that's not a true fever. A true fever is anything over 100.3, so 100.4 means you have a fever, okay? It might seem like minutia, but we have to make a cutoff. Some people don't have symptoms when their temperature is higher, but most people generally do. If it's low, you might feel chills or fatigue as well. That's also a sign of infection. Sometimes it can be lower than 98.6. Again, other people's normals are different, but generally we say 98.6 to 100.3. Okay? If it's high, you'd probably be sweating or having fevers, and again, you can also be having chills when you have a fever. So it's always important, if you're getting a fever, you might want to talk with your doctor about if you're having an infection that we need to treat with an antibiotic. Okay, so next we're going to kind of touch on some routine lab work, and the reason I call this routine lab work is this is lab work I get about once a year or every 6 months on almost all of my patients. Some of my patients don't have any medical problems, and so I don't necessarily get this lab work on them until they start having symptoms or we start putting them on medications for other diseases. So a CBC, you might have heard your doctor talk about your CBC is normal. That's your complete blood count. We have a CMP or a BMP. A BMP is a basic metabolic panel, and a CMP is a complete metabolic panel. These are tests of your kidney and liver function. We'll talk more about this in detail as well. A UA, that's just code for urine analysis. That's when we look at your urine and see what's going on. And then we often get cholesterol testing at least once a year or every 5 years, depending on what your physician feels like is needed. Other common tests we'll hopefully touch on today: thyroid function, HIV, vitamin D, vitamin B12, if you've ever heard about a hemoglobin A1C, and also microalbumin. These are tests that I order probably 2 or 3 times a day at least, if not more. So a hemoglobin and hematocrit, that's one component of your CBC, or it's actually 2 components of your complete blood count. Okay? The hemoglobin and hematocrit are basically how much blood do you have in your body. That is what we are testing when we test these numbers. You can see the ranges up here. I won't bore you by reading the ranges to you guys. But if it's low, you might feel tired, you might have shortness of breath, or you might notice that you're bleeding. These are all symptoms of having low blood counts. If it's high, you might get itchy, or you might be tired as well. Sometimes people can have too much blood, and that's a sign of another disease. Now, we don't do transfusions for blood counts that are lower than 11 or lower than 34. Sometimes we watch it, and we try to figure out why the blood counts are low. We've done a lot of testing, and we find that if we try to transfuse people for blood counts that are just a little bit out of range, we end up doing more harm to them than if we just try to figure out what's causing them to have the low blood count and then treating it from there. So that's why your doctor may say, oh, you have some anemia, and then you might think, well, why don't I need a blood transfusion? The reason is we need to find out the cause, because we could keep giving you blood, but until we find out the cause, you'll continue to have anemia. And oftentimes the transfusions can confuse additional testing that we would want to do to figure out why you're having anemia. And again, it can be harmful to get a blood transfusion. It's not without risk. Okay. The other component of the CBC would be your white blood cell count. This is a marker of infection. So if it's greater, it says 11.5 here, but based on the lab assay, I've seen it be as high, normal as high up to 13. And 4.0, I've seen it be normal as low as 3.5. If it's low or high, you might be feeling fatigued or feverish, and it is a sign that you might be having an infection. But also, if you've taken steroids recently, that blood count number is going to go up. Steroids make your white blood cell count number go up, not because your body is making more, it's that your body is releasing more of the white blood cells, because that's how the steroids are helping you fight off whatever is going on in your body. Okay. Platelets, this is a measure of clumping, or of your body being able to make blood clots. You can see the range up there. If it's low, you might notice bleeding. You might have a rash. The most common rash for low platelets is you might see little red dots on your skin that collect in areas that you've had trauma. If it's high, if this number is high, that might mean that you have inflammation or infection. Something's going on in your body that make that number high. If it's low, again, we need to figure out why it's low, and this is a little bit beyond this topic of having low platelets. But if your doctor calls you and says your platelet count is low, he or she is probably going to be ordering additional studies, or may send you to a hematology or a blood doctor to figure out what's going on. Oftentimes, some medications that you might be on might make the blood count low. So again, your doctor might say, well, just watch it for now. Okay? Again, if anything I'm saying is contradictory to what your physician has said, you can ask me afterwards and we can talk about what's going on in context of you. Everybody is an individual. Okay? So the basic metabolic panel, these are the components of it. We'll talk about each one of these in a little bit more detail. So your creatinine, how many of you have heard your doctor say, oh, your creatinine is high or your creatinine is low? You don't have to raise your hand if you don't want to, but just something to think about. This is the range. Again, some labs say that it's okay for it to be up to 1.3. Normal depends on a lot of things. It depends on what your race is, how old you are, and how much body mass you have, because this is a marker that will increase with the more hefty you are. Okay? It's a measure of kidney function, and it's a log function. That's just a fancy math term that means that we like this number to be low, not high. Okay? And it goes up incrementally in a way that's a bit beyond the scope of this talk as well. But small jumps in creatinine can sometimes not be a big deal, or sometimes they can mean a lot. So that's, again, you have to talk with your doctor about if this number is changing. Is this a big change or is this a little change? Okay. Too low might indicate that you're not having enough muscle mass. So symptoms of having a high creatinine, this again is a marker of your kidney function. So if this number goes up, that means your kidneys are not working as well as they could be, or you might be taking medications that make this number high. But symptoms of it getting higher, you might be confused. People that have high creatinines feel itchy. They always talk about, oh, I want to scratch. They might notice that their taste is different. They don't taste things as well. They might not be able to smell things as well. They would feel weak. Or they might have additional bleeding, because creatinine helps clear out things in your blood that stops your blood from clotting. So these are all symptoms of having a high creatinine. Potassium. This is a number we like to watch really closely because the range is really small. Again, sometimes if it's 3.3 or 5.5, that's okay, but it really should be within that range. Potassium is something that helps our hearts pump. It helps our muscles contract. It helps us move. It is involved in a lot of functions in our body. Sometimes we might call you and say, we need to redraw the potassium because if the vial of blood breaks, this is, again, machines are not perfect. So if your blood breaks, all that potassium goes out of the cells, and it makes us think your potassium is higher than it is. So if your doctor says, oh, your potassium was high, but the vial broke, that's okay. Signs of having disorders of potassium, if your potassium is low, you might be weak. I've had a lot of patients come in that say that they can't walk very well. We check their potassium and it's low, and so we need to give that back up. Things that can make your potassium low are certain medications that you may be on. We don't necessarily stop those medicines. We might replace the potassium that the medicine is causing you to lose. If the potassium is high, again, you can feel weak. You can have tingling. Okay? We look at these numbers very, very closely because if your potassium goes too high or too low, it can have effects on your heart, and we need to correct it quickly. Sodium, this is not necessarily the salt you eat, although it's the same kind of test that we're testing. This is the range. Again, low might indicate that you're dehydrated or that you have too much fluid on you. This is that point where I was talking about where I need to see you in the office to determine what this test means. I can look at you and see, oh, do you look dehydrated or do you look like you have too much fluid? High almost always means that you're dehydrated and we need to get you drinking more fluids or maybe have you come into the hospital for more fluids. The largest symptom of having a disorder of potassium is confusion. People that have low potassium oftentimes can be confused. People with high potassium sometimes can be confused. However, if this number changes slowly over a long period of time, you might not have any symptoms until your doctor calls you and tells you. The thing that causes the confusion is the quick drop in this number, in the sodium. Calcium, this is another lab that we check in the BMP. These are the ranges. If it's too high, you might get a kidney stone or a gallstone. You might have belly pain. The other thing we say is psychosis, or you might feel a little depressed or upset, more upset than usual. If it's too low, you might get tingling and numbness, again, abdominal pain. People that have low calcium, they notice that they get tingling kind of in their face and in their arms, especially if someone were to squeeze their bicep up here. You feel a lot of tingling with calcium disorders. Again, this might also be something that you don't have any symptoms of. And so we might call you and say it's low and we need to treat you. And because oftentimes people don't have symptoms, we'll follow it a little bit more closely. Glucose, what glucose is a measure of your sugar. This is the normal range. Again, higher, you usually don't have any symptoms. Although people with diabetes that have consistently high sugars, they get what's called polyuria, or they need to go to the bathroom all the time. I have patients tell me, oh, doc, I have to go to the bathroom like every hour, and I'm peeing a lot. And I usually try to think about diabetes with these patients. Or you're thirsty. You're just drinking so much water because what that sugar is doing is pulling all the fluid out of your body and dehydrating you. If it's low, a lot of times people will feel shaky, they'll feel sweaty, they'll have a rapid heart rate, or they might be confused or have nausea. So if you have diabetes, you should be familiar with these symptoms so you know to check your sugar. These are some other tests. I don't want you guys to focus too much on the BUN, the chloride, and the bicarbonate, mostly because these tests are not very helpful in isolation. We have to look at these numbers with all the other numbers we talked about, and these help us figure out if you're having too much acid in your body, if there's something else that's abnormal. So I didn't go into too much details about these because I don't want to confuse y'all, and at the same time it's hard for me to talk about them in an isolation because they work so closely with all the other lab tests we discussed. Okay. A CMP, or complete metabolic panel, this is a BMP plus your liver function tests. Okay. Bilirubin, that's one of your liver function tests. This is a test of how much, it usually is produced in your gallbladder. So if you have a high bilirubin, that can mean that you have some problems with your gallbladder or your liver, or it could mean that you're having problems with your blood breaking. And so your doctor will look at other lab tests that he or she has gotten to determine if they need to do additional studies, additional blood draws, or imaging studies of your body. Okay. Your AST and your ALT, I put the normal ranges up here. Again, this is often asymptomatic if you're having problems with it. And these are markers of your overall liver function. They can be high because of toxins, viruses that you may have, or medications that your doctor's given you. Your doctor might say your liver function tests are high, but don't worry about it. We're going to watch them while you're on this medicine. If it's low, it's benign. It usually doesn't mean anything. Or what we say when we say benign, it means it's a finding that we don't worry too much about. Or it could mean that your liver isn't working well. Again, we have to take that in context with other lab tests that we do. Okay. Other liver function tests in the complete metabolic panel, we have an alkaline phosphatase. Low, again, is generally okay. If it's high, we might do additional blood studies. We might decide to look at your gallbladder. It could be an indication of gallbladder disease, liver disease, bone disease, cancer, or it could mean that you ate something before the lab test and that's why it's high. So if this is high, I often call my patients and I say, come in first thing in the morning, don't eat anything, don't drink coffee, and we'll recheck it. Again, it's okay to be a little bit outside this range. This range is a pretty tight range up here that I put. Oftentimes, if it's as high as 120 or 130, I usually watch it for a little while before I do additional tests. Your albumin, this is how much protein is in your body. Symptoms of having low albumin are weakness or swelling. People that have low albumin swell a lot because this helps hold the fluid into your blood vessels, and when it's low, the fluid will leak out. If you have high albumin, you usually get blurry vision because that means that your blood is really thick. And so the first sign a lot of people notice is some blurred vision. It's usually high in a disease called multiple myeloma. There's also a lot of other diseases that are similar that can cause high albumin. Again, your doctor will look at your lab tests in context with each other and decide what additional testing should be done if it's high or low. Okay, a urinalysis, we look at your urine. We often can tell if you're having an infection, or we can tell if there's a problem with your kidneys by looking at your urine. So you might know, your doctor might say, oh, there's leukocytes and nitrites in the urine. That's just a fancy word for saying these are things that look like you might have an infection. If your doctor calls you and says, oh, there's blood in the urine, it might be infection, there might be cancer, you might be on a blood thinner that's causing you to have blood in the urine. Again, sometimes if my patients have blood, I'll say, let's just recheck it in a few months and see if it's still there. I have to look at them in context again. Or I might treat them for an infection and then test it in 2 more weeks. Ketones and glucose, these are diabetic markers. We look at these in our diabetic patients. If you're peeing out lots of ketones or glucose, we need to look at your blood sugar control and try to get that a little bit better. Protein can also mean an infection. It usually means kidney dysfunction, and we watch this and we take this lab a little bit more seriously. But if you're having an infection, you might have protein that clears after we treat it. So if your doctor says, we'll give you some antibiotics and retest in a few weeks, that's generally what I do. And then pH, color, and clarity, these are other things we get in the UA. We'll look at these in addition to all these other tests and determine how important they are in the context of your lab. Cholesterol. These are normal cholesterol numbers. I've kind of broken them down for you. LDL is your bad cholesterol, but it can be too low. The reason I say that is LDL helps it make up your brain material. And if we get that too low, we might decide to stop your cholesterol medicine. Your HDL is your good cholesterol. It can be higher than 59, and that's okay. That's generally a positive thing if it's a little bit higher. And then your triglycerides, that's how much fat is in your blood, and that's affected because of your diet. And this will fluctuate. If you've eaten, your triglycerides could be over 200, and that's normal because you just ate a big meal. There's a lot of controversy about testing people for cholesterol more recently. Your doctor may or may not decide to continue to do this based on some new studies that have shown that we need to look at everybody's risk factors in addition to these cholesterol numbers before we decide to treat. I have a lot of patients that have LDLs of 140 and 150, but because they don't have high blood pressure, they're not smokers, and they don't have a family history of heart disease, I don't treat them for their high cholesterol. I just ask them to increase their fiber intake and to exercise a little bit more. Some patients might have an LDL lower than 129, and your doctor might decide to treat you for that because you might have diabetes, you might have had a stroke, you might have had a heart attack. These are all indications for us to treat you with a cholesterol medication regardless of what your numbers are. So always talk with your doctor if you have questions about, your cholesterol was high or it was low, so why am I on this medicine or why am I not on this medication? Again, this goes back to us looking at you as an individual and your medical history and making that decision. Thyroid function tests. I'm sure a lot of you have had thyroid function or have heard of your thyroid. We test using what's called a TSH, or a thyroid stimulating hormone. It's opposite. If your TSH is low, that means your thyroid's working too hard. If your TSH is high, that means your thyroid's not working enough. It's counterintuitive, and it's something that we have to review in medical school. So if you're confused and your doctor is adjusting your medicine opposite what you think, it's probably because of this counterintuitive nature of this test. If your thyroid function is low or you have hypothyroid disease, the more common symptoms are weight gain, constipation. A lot of people don't realize that constipation can mean thyroid disease. Swelling of your legs and swelling of your whole body if it gets to a severe point. Fatigue, and some people notice that they might be mentally slow or sluggish. Symptoms of having a high thyroid: you might lose weight, you might feel anxious, you might have dry skin, you might be fatigued. And just like with low thyroid, you have constipation. People with high thyroid, they don't necessarily have diarrhea, but they go to the bathroom a lot more frequently. Other tests we get, I usually get HIV tests. The CDC recommends everybody gets tested for HIV. It's usually asymptomatic, that's why they recommend testing for it. Vitamin D, I usually check this test if there's a problem with your calcium, or I get a bone mineral density scan that's abnormal. We'll talk more about bone mineral density in a minute. If it's low, sometimes people feel tired, but generally it's an asymptomatic lab. And then B12 is another lab that we often check, and if it's low, it could indicate fatigue. It's also very important for mental functioning, so I'll test it in a lot of my patients that I screen for dementia or cognitive impairment. If they end up having one of those two things, I'll test their B12. Diabetic test. If you're a diabetic, every 4 to 6 months, your doctor may order a hemoglobin A1C. This is a marker of your average blood sugar over time. If your A1C is greater than 5.5, it doesn't mean you have diabetes. It just means that you might be at an increased risk for getting diabetes, and so you might want to change some things in your diet or daily activity. If you're over the age of 65, we usually relax the parameters. Our goal for our diabetics, and I didn't put this up here, we like most of our diabetic patients to have an A1C of 6.5. This means that we're reducing their risk of having complications from diabetes without making their sugars drop too low. Once you get past the age of 65, we relax it a little bit. It's the same thing with blood pressure. We can make you feel really bad, and we can also make you pass out or have more complications if we try to make your blood sugars too low. Microalbumin, this is another urine test. It's a special test independent of the UA. We're testing you for protein in your urine because diabetes can affect your kidneys. So your doctor may get a urine test about once a year to see if you might be having protein in your urine. The treatment for this is to put people on medication called an ACE inhibitor or an ARB. There's a lot of medications that live in that class. If you're already on that, your doctor may decide not to test your microalbumin because it's not going to change what they do. Okay? Everybody that has diabetes should have a foot exam at least once a year. What we're doing when we look at people with diabetes feet is we're making sure that their circulation is good in their feet and that they can feel things in their feet. We're also looking for any risk factors they may have for having other kinds of foot disease because the first place diabetics lose feeling is in the bottoms of their feet. Also, if you have diabetes, you should get an eye exam every 1 to 2 years, depending on what your eyes look like to the eye doctor. The reason I bring up these tests is I want to make sure that if you have diabetes, you know what testing you should get so you can be proactive and ask your doctor to do these things for you. Sometimes we get really busy thinking about other problems that you may have, and so it's good that you know to remind us about this. Health screening tests, these are tests that everybody should get. Everyone should have a colonoscopy starting at age 50 or screening for colon cancer. There's another way that we can screen for colon cancer. It's a fecal occult blood test. That's a stool card that you take home. We collect your stools and then we test them for blood. The reason I prefer colonoscopy over the stool card is with colonoscopy, if it's normal, we can wait 10 years before we screen you again. If it's abnormal and we find polyps, we can often remove them before they become cancer or before they become a bigger problem that needs to be treated. But if you're really shy of doing the colonoscopy, you might want to do the stool cards. The only problem is if they come back positive for blood, then we would ask you to do the colonoscopy. If you have a family history of colon cancer or you're anemic, your doctor may decide to test you more frequently or earlier in life. The other thing about the colonoscopy is it is a procedure with some risk. So based again on you and your medical history and what medications you are taking or may need to be taking, you might discuss with your doctor that a colonoscopy is too high risk for you. But again, in general, most people at the age of 50 should start getting them. And there's no guideline about when to stop. With most screening tests, we don't have a guideline on when to stop because we just don't know how beneficial. So this is a conversation you should have with your doctor about when it's appropriate to continue and when you might want to stop doing some of these tests. For smokers, I've had a lot of patients that say, oh, doc, I'm a smoker. Do I need to be screened for lung cancer? There's some new data out there that suggests maybe, maybe not. It's a little bit confusing, and so you really need to talk with your doctor individually about this. Let's see. For women, cervical cancer screening is very important. It's done with a pap smear. We start at age 21 and we stop at age 65. Again, based on your risk factors, we may do it earlier or later on in life. It just really depends on what your previous pap smears have been, if you're a smoker, family history, other exposures. This is a test we get every 1 to 5 years. The new guidelines say if everything looks normal in women over the age of 30, we can do it every 5 years. But again, your gynecologist or your internal medicine doctor may prefer to do it more frequently based on other risk factors. Breast cancer screening, I don't know if any of you guys remember about 4 or 5 years ago, there was this big controversy about stopping breast cancer screening for all women at 40, and that created a bit of concern in the general population. Generally, I say we start between the ages of 40 or 50 based on your family history, whether you're a smoker, you're obese, your hormone therapy exposures. However, everyone starting at the age of 50, all women should start getting mammograms. And based on what those mammogram results are, you should get them every 1 to 2 years. However, this is like the colonoscopy. We don't have any guidelines about when to stop. Generally, I talk with my patients when they get a little bit older about whether or not they want to continue with mammograms and breast cancer screenings. This is a conversation you should have with your physician. I talk with people about what they would do if the test results came back positive, how they would feel about that, and kind of guide my decision about whether or not to go forward based on that. And then osteoporosis. Every woman should be screened for osteoporosis starting at the age of 65. If you have other risk factors, again, your doctor may decide to screen you earlier. But if you haven't had a bone mineral density scan or a DEXA scan, ask your doctor. The treatment for osteoporosis is fairly well tolerated, and there are a few contraindications, meaning there are a few reasons we might decide not to treat somebody with weak bones. But again, this is something that maybe your doctor's been thinking about, they just haven't had a chance to mention to you. So if you haven't had one, ask your doctor and see what he or she thinks. Okay. For men's health, prostate cancer. This is another very controversial area of screening. I suggest talking with your doctor about what symptoms or family history you may have. Again, it can be helpful, it can be harmful. This is a test that there's just a wide variety of data, and based on which physician you ask, they might advocate for or against it. So you need to talk with your doctor about your own individual risk. And if you're a man and you've smoked more than 100 cigarettes in your entire life and you're over the age of 65, we recommend getting screened for something called an abdominal aortic aneurysm. The abdominal aorta is that big vessel that lives in your belly. Smokers often have weakening of that blood vessel, and so we screen men over the age of 65 with an ultrasound. For women, there's no data on whether or not this is helpful, so we don't generally do it. Vaccines. So shots are not just for kids, they're for everybody. Everyone should get a tetanus vaccine every 10 years. If you've been in a car accident or had to go to the emergency room, you probably have gotten one. Tdap, this is a special kind of tetanus vaccine. It has also diphtheria and pertussis. Tetanus is a bacteria that lives out in the environment and can cause lockjaw. Diphtheria is a very rare bacteria. I've only seen one case of it, and the reason I've only seen one case of it is because we vaccinate against it, and you don't want to get it. It can create a lot of problems with your throat and respiratory tract. And then pertussis is whooping cough. This is what little kids get when they cough and cough and cough for months and months and months. They can give it to you, and you can give it to them. So if you're around kids, you might want to talk with your doctor and make sure you've been vaccinated for pertussis. Shingles, this is a vaccine that everybody should start thinking about at age 60. That's just because that's what the insurance will pay for. Shingles is old chicken pox. If you've had chicken pox, you're at risk for shingles. Shingles will come back as a rash that is extremely painful. Anybody that's had shingles says that they wish they had never had it or heard of it because it is so terrible. I will tell you what I tell all my patients. Getting the shingles vaccine does not prevent you from getting shingles, but it does reduce your risk of having shingles, and it makes any shingles that you have, it makes your body able to fight it off a little bit better and make it a little bit shorter duration. Pneumovax, pneumonia vaccines, so there's two. There's Prevnar and Pneumovax. You can get one or the other starting at age 65, and you do them a year apart. If you have a medical condition like COPD or diabetes or a heart condition, your doctor may decide to give you Pneumovax a little bit earlier. But these are both really important for helping prevent pneumonias and helping build your body's strength up against any pneumonias you may get. Flu, everybody should get a flu shot every year, period. All right. We have a little bit of time. So I get a lot of questions about how to stay healthy. The first thing I tell people is to stop smoking if they're smoking. That will not only give you cancer, but also increase your risk for having heart disease or heart attacks and strokes. A lot of people think it's just lung cancer. It's not. It's all different kinds of cancers and heart attack and stroke. Wear your seatbelt when you're in the car. It's really important. You can save your own life if you wear a seatbelt. They're called accidents for a reason. Nobody plans them. Okay? Get active. Try to walk 30 minutes a day, 5 days a week. Try to lose weight if you can, if it's appropriate. And again, watching the alcohol intake. I know we're at the Baptist church, but we'll talk about that in a little bit. And make sure you follow up with your doctor. I get a lot of questions about weight loss. These are things I tell all my patients every year. Don't drink your calories. What that means is juices are not healthy. People think juice is healthy. It has a lot of sugar in it. Smoothies, that's a little bit different, but juices for the most part have too much sugar. People drink a lot of sweet tea and soda. We're in the South, we love our sweet tea. That's going to add a lot of empty calories to your diet. Exercising, like I said, 30 minutes a day, 5 days a week, that's just walking briskly. You know, you have a large campus here. You guys could probably walk inside. I think there's a gym, isn't there? Yeah. So there's a gym here. You can walk indoors. I have patients that walk at Walmart because it gets dark early and they're not members of a gym. These are all different ways that you can get your exercise in, especially in the winter when it's cold and dark and you don't want to be outside. Eat protein at every meal. Protein isn't just meat. Protein is beans. Protein is eggs. Protein is yogurt. Protein is cheese. These things help you feel full. Half of what you eat should be a fruit or a vegetable. I'm looking at y'all's salad plates. I think that's a really good balanced meal. It has a little bit of carbohydrate, protein, fruit, and vegetable. Hydrate. Make sure you're drinking water. Don't drink too much water. Just drink when you're thirsty. If you have liver, kidney, or heart disease, your doctor may tell you a little bit more precautions about what to be drinking. There's a lot of data out there. People say, oh, I'm supposed to drink 8 glasses of water a day. No. If you drink 8 glasses of water a day, you're going to be going to the bathroom 20 times a day. Drink when you feel thirsty. Drink before you eat a meal. Make sure you're just taking sips of water throughout the day. But again, talk with your doctor because some people want to be healthy and they want to be drinking water, so they might overdo it a little. And don't cut out any food groups. I have lots of people say, oh, I'm going to lose weight. I'm going to not eat any carbohydrates. I'm not going to eat any sweets. That's unrealistic. Allow yourself treats every now and then because otherwise there's going to come a day where you're tired of your diet and you're just going to stop doing it. Losing weight is not a 6-week thing. It's not an 8-week thing. It's a lifelong thing, being in a healthy weight. Alcohol use. Okay, I know we're at the Baptist church, but I'm going to talk about it, so maybe you can tell your friends that drink why it's not so good. First, I'm going to define at-risk drinking. That doesn't mean that you're an alcoholic if you're an at-risk drinker. This means that you're just at increased risk for having obesity, high blood pressure, liver disease, or heart disease. Again, if these drinking habits seem familiar to you or your friends, it doesn't mean that they're an alcoholic. It just means that they're at increased risk for having these diseases. So at-risk drinking for women is more than 2 drinks in an evening or 7 drinks a week. Men get a little bit more because they have more alcohol dehydrogenase, the chemical that breaks up the alcohol in their body. So 3 drinks a night or 14 drinks total in a week. That doesn't mean, ladies, that we can drink 2 glasses of wine with dinner every night. Or men that you can, have 3 glasses of beer with dinner every night. It just means these are some guidelines to help guide you about what's healthy and what's not so healthy. Binge drinking, this is drinking too much in one period of time. That's 4 to 5 drinks in any occasion, a birthday party, a celebration. The reason that this is at-risk drinking is it can make you have poor decisions and increases your risk for having accidents after you leave the event. And you can also be eating more calories than you realize because your inhibitions are lowered. And that's my talk. If you have any questions about where I got this information, you can always go to the CDC's website. That's the Center for Disease Control. They have lots of good information about vaccines. The United States Preventative Task Force, those are the guidelines I use when I talk about cancer screenings. And then the American Diabetic Association, that's the information I got about the diabetes. And then most of the other information is just knowledge I've picked up over the years. All right. Thank you, guys.